Hello to all of you, and welcome back to the ChildSafe podcast series. In this edition, we talk specifically around child abuse, violence against children, and child safety, all under the umbrella of Child Protection Week. In this edition, we are very blessed to welcome to the ChildSafe series a professional that has started off a career in nurturing, caring, and loving those most in need. So Dr. Cowlin has started her career as a midwife and progressed as a professional nurse later on, and then pivoted into psychology. And so that is a career path that I think all of us can agree is definitely one of a nurturer and a carer. Now, in her work now, within a hospital setting and within her private practice, she works specifically with children that is affected by non-accidental trauma. Welcome, Dr. Cowlin.
Thank you very much. And please call me Avril.
Hello.
Most psychologists are never called doctors. Even if we have our PhDs, we're so used to dealing with people on a one-to-one basis, and it creates a barrier.
Sure.
Yeah.
Avril, thank you so much for agreeing to come and talk to ChildSafe. I'm going to kick off with some of the statistics in terms of what I have read in the literature. As much as 40% of South African children and adolescents will have been exposed to some form of abuse before they turn 18. So in the umbrella of Child Protection Week, we know that those trauma-related cases can be either intentional or non-accidental, or they can be accident or, can I call it, injury-related. So can you help us just understand the differences between that injury-related trauma and then the non-accidental related trauma?
It's a really interesting question, and quite frankly, I'm surprised that it's only 40%. And it depends on what we're talking about in terms of trauma. Trauma includes neglect, which is something that's seen as a soft kind of trauma, but it has an impact. So we're talking about intentional physical harm,
Right.
Sexual abuse, violence, and we're also talking about the kind of accidents which occur because there's no parental supervision, because the circumstances are not conducive to a child being safe. If you live in an informal settlement, it's difficult to put checks and balances in place in terms of injury from domestic activities, just the hot water kettle. But for a child who has a pot of hot water spilled over their face and abdomen, that is a trauma. It may not be intentional. It's circumstantial. And in our country, with our vast disparity in economic standards, a lot of our people are suffering from that kind of trauma.
Yeah.
Does that make sense?
It does.
And of course, you've got your intentional trauma, beating, injuring, and sexual trauma, which is prevalent in our particular area to a large extent.
So, I mean, also in literature, we look at the drivers of those cases, which is poverty is a big one. And, people are really battling out there. So when we look at some of these cases of trauma and how they manifest within the different age segments of children, and I'm asking it in the context of how do we identify when a child might need, can I call it, not investigation, but further support?
We used to believe, and it's an African saying, as in Africa, it came from the Yoruba or Igbo tribes up north, that it took a village to raise a child.
Right.
We live in South Africa, where we talk about Ubuntu, where I'm a person because I see you as a person. And somehow we've lost our way. And we've forgotten that we're all responsible for all children.
Right.
And there are red flags that should let us know that there's something wrong. But there are really overt things, like when you see a child being beaten by a parent and people will walk past. You'll know that somebody is drinking or substance abusing and the children who are hungry. And we avert our eyes. So we become complicit.
Right.
And, you know, in the patients I see, one of the most important things with children is to notice any change in their behavior. And when you're dealing with parents who are overwhelmed by those things, like poverty and lack of resources, who are exhausted from trying to maintain their quality of life such as it is, those things sometimes go unnoticed. That a happy child who used to be social and engaging suddenly is withdrawn, doesn't want to go near a particular person or doesn't want to socialize. Those are the kind of red flags.
All subtle, though.
Yeah, but when you know what they are, it's one of those things when you know you can't pretend you don't.
Yeah.
And the other thing is, and this is sort of at the other end of the spectrum, when a child becomes, we talk about in my job, we've got all our sort of cliches and our terminology, over familiar, lacking in boundaries. That sets up alarm bells as well. Because a child should have that space in the middle where they understand their own parameters of safety. And when those come down, it gives us as professionals and it should, you know, the general population, why is a little girl running up and hugging every man she sees?
Yeah.
That's not being an affectionate child. That's a child who doesn't understand that her body needs to be kept safe. That's what I'm saying makes sense at all.
Sure.
So these little things, you know, a child who was previously potty trained, or an older child suddenly becoming incontinent, either, you know, fecal or urinary incontinence, and there's no physiological reason for it. Those are the kind of red flags that alert the professionals, but which need to be in the consciousness of the general person. So that when a child behaves in a particular way, there's a stop, there's a response, not giving the child a hiding because it's suddenly wetting the bed, thinking with curiosity, why? What's changed? This child's behavior has deteriorated, regressed to a previous stage.
No, it's such a caring approach that you've highlighted to, and I think that many parents and those charged with the minding of children might easily overlook, because it's easy to want to discipline a child for wanting to wet a bed, and not looking at it through a lens that there might actually be something subconsciously that is making that child react in a particular way.
Absolutely. Yeah. Absolutely. But I think, you know, I'm very interested in the mind and body, the intersect between the psychology and the physiology.
Right.
And part of what we're talking about is, are we giving our children cues of safety? Are they safe in the company of the adults that are taking care of them or not taking care of them?
I think you've also mentioned such a crucial thing. I mean, even with your background as a nurse, can I call it Western medicine practice hasn't always included mental health as part and parcel.
Absolutely.
So I'm, laying emphasis precisely on that holistic approach, bringing together both the physical and the mental part, or the mental health part of it, is so important.
Absolutely.
Yeah.
When I did my PhD about 10 years ago, it was on medically unexplained symptoms in low-income women on the Cape Flats. I worked in 2 hospitals on the Cape Flats, and I was getting these women being referred to me by the physicians because they had pain or symptoms that they couldn't explain. And at that stage, there was very little literature on that mind-body connection. Now there's an enormous amount. And there's a lot of emphasis on childhood trauma. And the way in which that will dictate how that child grows up, engages with other people. Because if your caregiver is brutalizing you in some way, or not giving you a sense of safety,
Right.
your physiology changes.
Okay.
So you become more, fight or flight, sympathetic, you're constantly triggered in that protective mode.
Mm.
But equally important, and this is more a psychological thing, is we talk about attachment.
Mm.
And a child learns how to attach to other people in those early years through their caregivers, their mother, their father, their granny, whoever. Right. And we know that a child who has been exposed to somebody that they can trust develops what we call a secure attachment.
Okay.
That little girl, I was hypothetical little girl who runs around hugging everybody, she has got a disruptive attachment.
Right.
She's unable to attach appropriately. And I think in the West, we want to compartmentalize things and categorize them. But there's an overlapping, like a Venn diagram. Your environment, your engagement, your physiology. Are you normal? Do you have disabilities? Are your parents together? They all overlap to create a very individual picture.
Right.
And in the West, we love the individual focus. But as human beings, there are certain criteria which are general to us all. The need to be loved, the need to be cared for, the need to feel safe. And when those things aren't met in your early years, you grow up to be an adult who doesn't ever feel safe. He's constantly in a state of fight or flight, of protection. And that plays out in aggression. I mean, we live in a country of aggression. A colleague of mine went to the Ukraine recently to see the children there because it's a war zone.
Right.
And we were talking about it, and I said, our kids here in certain areas are living in a war zone. And we know that that's a kind of a predictor of how they're going to grow up as adults.
Do you think, so when we look at the saying, hurt people, hurt people. So if you then look at a child that has got, can I call these deficits, in
these injuries,
injuries as they grow older. So what are the likelihood that those injuries are then either perpetrated or passed on into the next generation?
Well, there is a strong body of research about intergenerational transference of trauma. And certainly we know, again, coming back to children who are being exposed to certain behaviors by the adults, they are being set up to understand those behaviors as normal.
Right.
They then perpetrate them. And we have these kids who display sexualized behavior, which is another red flag. A little child being very sexual in their behavior. We know that means that they have somehow been a recipient of that kind of thing. And so that becomes the norm to them. So if you are molested, and we've got kids who've been molested, they're now in the penal system as adolescents because they are now molested.
So there is definitely a repeat cycle.
Yeah. You know, for as long as we've known, you know, abused children may become abusers, or they may become very caring. There's this kind of a ricochet. You either emulate or you go the complete opposite.
Polarized.
A child who's brought up by alcoholics. And that whole nature-nurture thing is a controversial issue. Is it a genetic propensity to drink alcohol, or is it because you've watched your adults?
A learned behavior.
Yeah. But so many of those children become teetotalers.
Right.
And so it's about the adults in the professions of which I'm a part who need to be curious with compassion about what's going on in our young patients' lives and how to generalize that to the broader population.
So, you know, I've also heard when I hear professionals speak, they speak about raising children with empathy or teaching them empathy. How does that sort of correlate in correcting, can I call it a social ill? to maybe correct what they perceive as this normal, because I think this normal that you've just mentioned is an actual fact a swear word, and I think it's an illusion.
Yeah, well, I often talk when my patients talk about I'm not normal. I say we expunge that word from our vocabulary.
What is normal?
Exactly.
Right.
I think what we're talking about is, or the question we need to ask ourselves is, how does an adult who's never experienced compassion provide compassion to their child?
Right.
It's about how is their child helped to regulate their emotions? And we know that there's a co-regulation with the other person. And it's subtle. It's how does the mother or the father engage with the child? How do they look at the child? What is their facial expression when they're looking at their child? What is the tone of voice? And, we're sort of skirting even the issue of technology, that we get co-regulated by other people. But what are our kids playing? Even children in income-deprived circumstances, they've got phones. They've got a phone that is spewing out all kinds of information, violence, but there's no reciprocity.
Yeah.
It's a one way.
Right.
And there's nobody to assist that child to evaluate that information.
To filter it.
Yes. Even, I see moms walking with their children, their babies, and instead of, back in my day, you would talk to your child and you bend down and you look at them and you check if they're working. They're on their phones. So, we're talking about a hugely complex situation. Child protection, what is that? On what level? And where's the focus going to be?
Right.
We go for the big, brutal things. The child's been raped, the child's been stabbed. But what about the subtleties that are depriving our children of learning empathy and compassion?
Right. So as we are on that topic now, thinking about balancing it out with recognizing children as autonomous beings. So, that autonomy that is granted to them in law, and it is one of the key things that made me sit up when we had the conversation with Natasha Wachit from ENS Africa, the law firm, in saying that we often forget that children are autonomous. They are their own individual. They have their own personality and their own pursuits in life. How does that then fit in with a parenting role, in the sense that sometimes you may get children that are not necessarily supervised or given the necessary care, to the other side of the scale where parents say, this is my house, you're going to do what I say, you will do it my way, and almost obliterating the child's autonomy in the process?
I'm going to sound like I'm going off topic, but I'm not.
No.
There's in all the kind of mainstream data in terms of social engagement, there is this delineation between engaging with the other is another person, whether it's a child or an adult, either through fear, and fear itself, when we do things because we're frightened for ourselves, we're frightened for our children, we tend to close our focus, become, isolated and self-absorbed.
Right.
If you can flip your engagement with whatever you're talking about, your child's behavior, what's happening to them at school, with a sense of gentle, compassionate curiosity, the whole engagement changes in its flavor. It then stops being punitive. That parent who says, you'll do things the way I say, what is driving that? The need to make everything safe because they're scared. If they were able to engage with their children developmental stages are important. You don't have a philosophical, discussion with a 2-year-old.
Right. Age appropriate.
Absolutely. But as long as you can elicit in your child or have them, elicit them a sense of being seen and heard and understood, in a respectful way.
Within boundaries.
Within boundaries. And again, age appropriate. But so many of our parents, and I'm talking across the spectrum, from low income parents to high income
affluent,
parents,
yeah.
they so often don't have those boundaries in place themselves. They can't self-regulate themselves. That's why they lash out or they abdicate responsibility for their children.
And therein lies the danger.
Yes, and then it becomes a self-perpetuating system.
Right. Right. So when we look at when some of these things play out in terms of trauma, be it intentional or unintentional, walk us through the mid, medium, and long-term effects. So we touched briefly on some of the physiological manifestations in terms of what could happen and the red flags that we need to watch out for. Surely the approach and the treatment is slightly different to the older they get, or it becomes easier to treat. I don't know.
That's quite a difficult question to answer, because it almost sounds as if I'm talking against what I said earlier about we are too individualistic in the West. And again, I say to all my patients, you've got to find that sweet spot between the binaries,
right?
Between the extremes. On the one hand, the over control. On the other hand,
no control.
Yeah. And that place in the middle. And for children, it depends on that individual's stage, age, and capacity to engage. But in general terms, the way we engage with a small child, you use play. As they get older, with an adolescent, you can talk.
Yeah.
My job's called the talk therapy. But sometimes neither of those is appropriate. Right. And you have to be willing as a professional and as a parent to be able to meet the child where that child is.
Yeah.
But a large proportion of that, again, I'm coming back to my little drum roll, is making that child feel safe. Being able to soothe their hypervigilant nervous system from the fight or flight to the tend and befriend, to move it from the sympathetic to the parasympathetic, so that their physiological response
is calmer,
calm down, so that then they can engage with whatever the activity is.
Yeah.
And that applies across the lifespan. If you feel safe, whether you're 2, 22 or 102, you are more available to be helped.
Receptive.
Yes.
Yeah. I want you to repeat that approach with compassionate curiosity. And I think that is such a crucial message for our viewers, parents, caregivers, even professionals dealing with children.
Absolutely.
It goes for doctors, it goes for police officers, it goes to everybody, to approach in that curious,
compassionate, curious, compassion, curious,
compassionate, curiosity.
Yeah. Right. There's a huge cohort of medical people and mental health professionals, particularly in the States, who are focusing on this whole concept of being compassionate in our engagement.
Right.
And how much harm we do when we forget to take that into consideration.
With compassion and empathy.
And ironically, there's a wonderful man called Gabor Mate.
Yes, I'm familiar with his work.
There's a YouTube video with him talking to a man called Stephen Porges.
Right.
Now, Stephen Porges developed something called polyvagal theory, which is developed into a therapy. Very much a physiological focused one in helping people find cues of safety.
Right.
As a species, we are cued for danger. That's how we survive. Now, if we walk down a dark road in the middle of the night and we go so ho-hum about it, we could be attacked. We need to be aware. But when we're sitting somewhere safe and pleasant, we need to be able to then cue into the safety.
Yeah.
The one practitioner calls glimmers of joy. But in order to do that, we need to understand what's going on physiologically, but we dismiss it. And I don't know, I won't mention the name. There's a very high-profile American politician who is running for office. And in one of her interviews, she, with great pride, described an incident from her childhood where she'd been playing outside and she'd been badly bullied, and she came inside distraught. And her parent or her grandparent, whoever was looking after her, said, listen, in this family, you don't have cowards. You get out there and you deal with it. And that child was looking for a cue of safety from a caregiver who threw her to the wolves. And how that becomes part of the physiology and therefore the psychology. You tough it up, you suck it up, and you
soldier on, and walk it off.
Yeah, and you enact the same amount of disrespect to other people.
Sure.
That inability to tap into their needs, physical, physiological, and psychological.
Yeah. You know, it sounds to me like somewhere along we're falling short in terms of taking care of our children. And when I say falling short, you know, it's more an ask for those charged with the minding of children to be introspective and to first see how their role could potentially affect or play out in that child's development. It goes for caregivers and parents and everybody involved. And I'm going to come back to that curious, compassionate curiosity that we spoke about, because I think it's such a beautiful way of looking at it. Is there anything else that you want to add, you know, in the context of Child Protection Week from a psychological perspective, or a message that you want to give to people framed within this week of child protection?
You know, it's a chicken and the egg kind of scenario. And there's a psychologist in America. She's not clinical, she's a research psychologist. Her name is Kristen Neff. And she's done a lot of work on self-compassion and engaging with oneself in the same kind of way as we advocating you engage with another.
Right.
You know, I love adolescents. I absolutely love adolescents. And they'll come in and they'll say the most awful things about themselves. You know, like the boyfriend has broken up with them, and they'll say, well, no wonder, you know, I'm fat and ugly and stupid, and no wonder he threw me aside. And then you say to them, would you say that to your best friend? And they are aghast.
Yeah.
Of course not.
Yeah.
And so this kind of starting somewhere. And if we can help our adults to negotiate themselves into a place of care for them and respect for themselves, that will translate into them being able to do so for the children, their children. You said hurt people hurt people. And if you can soothe your own hurts, that enables you to stop that cycle. Does that sound a bit fuzzy?
No, it sounds very clear. And if there are parents out there, or maybe somebody that would want to reach out to you in private practice, how would they be able to get hold of you?
I actually don't see kids in private practice.
Okay. Parents?
Yes, I do. And we need to start with parents. And there's also, apart from those of us in private practice, there's a wonderful place called the Parenting Center. And I almost think that's where we need to start.
Okay.
You know, we're putting a Band-Aid over gaping wounds. When we're sort of trying to patch up these kids. We need to stop that from happening.
Because again, the holistic approach.
Yes. Of setting up, I really believe setting up programs to help parents instead of vilifying them and criticizing them. And believe you me, it's very tempting.
It's more prevalent than what we care to admit.
Yeah, but we need to support them in making the right choices,
right,
in making the right parental choices.
Sure.
Which is difficult if you weren't parented. You know, so it's a quagmire. But one always hears the story of the little girl and the starfish. And she's on a beach, and there's a whole beach full of hundreds of these starfish that have been stranded. And she's picking them up and throwing them into the sea. And an old man's walking along, a cynical old man, and he looks at her and he said, "What are you doing?" So she said, "I'm saving the starfish." So he said, "There are hundreds. What difference does this make?" And as she picks up the one, she throws it into the sea. She said it made a difference to that one.
Right. One at a time.
One at a time.
Yeah. Avril, thank you so much for joining us in the ChildSafe podcast series. And thank you for bringing our attention to look at children with compassionate curiosity. Yeah. I think I'm going to drive that message through. And for doing the kind of work that you do that, heals people and brings people back to becoming contributing, happy members of society.
I'm going to just correct you on one thing. We don't heal people. We help facilitate people to heal themselves.
Oh.
And that's a difference, because if you were talking about autonomy for children,
right,
but we need to have that respect for everybody across the spectrum, that they can do it themselves. We support them in their process. And the other thing is that you're all responsible for all the kids. Let's not turn a blind eye. That's an equivalent crime when we know something is happening and we don't speak out about it.
Thank you. If you've enjoyed the content of this video and would like to see more of it, please like, share, subscribe, and push it in your network so that others can also benefit from the insights we've gained from Avril here today. From ChildSafe South Africa and Child Protection Week, thank you so much for joining in. Until next time, take care.